Okay, good morning everyone out there in webinar land. This is my first webinar, so I'm a little bit nervous. I've done lots of presentations in front of people, but as a webinar, this is my first one. So today's webinar is obviously on WHS, and what I'm going to concentrate on is obviously working from home and the transition back to work after COVID-19 this year, and really focus on WHS in general, and don't set things in place like your policies and procedures and then forgetting them at some stage down the track. So that'll be the focus of the webinar today. So a bit about the agenda, obviously a little bit about my background, the reason for today's webinar, and then, as I said, concentrating on don't set and forget your policies and procedures and the requirements that we have under the legislation, looking at our compliance requirements for WHS, the risks, health and safety strategies for supporting our staff who are working from home, and obviously transitioning back to work and employers' requirements and obligations when employees are transitioning back to work. And then we'll have some time for questions at the end. Thank you for joining us again. So just a little bit about, sorry, I'll go back, about my background. I've been in HR, I suppose, for a long time, 25 years, maybe 30. 25 years in the teaching environment at TAFE, 17 of those teaching and running commercial programs. And then working in the corporate office in HR and putting policies and procedures together and managing projects. The last couple of years, I've been with Standard Candle HR, and I'm a senior HR and WHS consultant, basically working with different organisations, from manufacturing to not-for-profit organisations, as I said, manufacturing, warehousing, etc. And basically what we do is, and me in particular, I go into organisations, we undertake either a HR audit or a WHS audit, and then we make recommendations to organisations to make sure that they're complying. As you know, there's lots of legislation, especially in WHS. You've got the WHS Act and regulations, codes of practice, and also our standards. And there are monetary penalties and obviously jail terms if we're not complying with our obligations under the WHS legislation. So it's really important that we have a WHS framework. When I do go into organisations and conduct audits, those audits are based on obviously the Australian and New Zealand standard 45001 that was introduced in 2018 in regards to setting up WHS management systems. So all the recommendations are based on that and the requirements under the legislation. Today's seminar and the reason for the webinar today, it's obviously connecting with our clients and also with yourselves, my colleagues, I can say, on LinkedIn, to obviously discuss the WHS in particular today, and obviously for you to get to know me a little bit more and a little bit more about what Standard Candle HR has to offer you, to provide you with ideas to consider in regards to, in particular today, again, WHS, and probably reinforcing what you're doing. In most instances, organisations are doing the correct thing, but they might just want to ensure that they are doing the right thing, and that might be one of the reasons why you've actually attended the webinar today. It's also part of our growth, branding and website upgrade. So you will find that this particular webinar has been recorded and it'll be available on our website at a later stage. And you can always access our website and see what other services we can provide for you. And in particular with WHS, you might want to contact us and we can have a conversation about what we can offer you in that regard. Okay, so let's get started in regards to WHS. As you know, in March this year, due to COVID-19, many organisations due to the health orders, the public health orders that came out from the governments, both federal, national, and within the states, advised their employees that they would need to work from home because it was no longer reasonably practicable to actually work in the workplace because of COVID-19. So we had this mass exodus from workplaces, what we call a workplace, our normal workplace, to working from home. And in reality, if you really think about it, the home can be a work environment. There were a number of employees that would probably work from home at least 1 or 2 days a week before COVID-19. But COVID-19 meant that we were working from home for 5 days a week and sometimes 6 days a week to catch up on what we hadn't been able to do. I know when I was working previously, I was working 6 and 7 days a week from home because we were trying to finish off projects. So is the home a workplace? Yes, of course it is. The New South Wales WHS Act 2011 actually defines a workplace as a place where work is carried out for business, and that includes any place where a worker goes or is likely to be while they're at work. So obviously, if we've been asked to work from home, then our home will become our workplace for that period of time. So in the last couple of months, since people have been working from home, what have been the statistics in regards to claims made by employees from home? Well, Comcare have recorded 25 claims from April to June. So Comcare is the national, I suppose, WHS administrator, and they administer the federal legislation for obviously federal employees and also for public service employees at the federal level. 25 claims may not seem like many, but the previous year there was 0 claims that were made for individuals who were working from home. SIRA in New South Wales actually has recorded 105 claims as at the 31st of July 2020. Again, a small number of claims when you compare it to the total number of 8,055 claims as at June in 2020. But still, these claims have been made. And both administrative bodies have advised that the causative factors for the claims that have been made for people working from home have been basically workstation setup, falls, slips, trips, etc., and soft tissue conditions, overuse and repetitive motions within the workplace, probably because people are maybe working longer hours or not working in a ergonomic environment that is suitable for, in the home, that's suitable for working. So when we're in the workplace, and I'm talking about office or warehouses or manufacturing organisations, etc., we have policies and procedures in place. Yes, we do. And we have policies and procedures that outline the requirements that are set out through the legislation for us to ensure that the health, safety and wellbeing of our employees is maintained. And we provide and maintain a safe work environment so far as is reasonably practicable. That is what the legislation says. So in the workplace, we set up policies and procedures and we make sure that our employees are following our safety guidelines. We have incident reporting mechanisms, we have risk management processes in place, and they work well. But what happens when somebody works from home? How do we ensure that these particular individuals are actually undertaking risk management and that their workstation has been set up appropriately and that they're following the guidelines that have been set up? And if they do have an accident at home, that they're actually reporting that particular accident. Well, we've got to have some strategies. So the legislation basically says that employers have a requirement to provide a health and safe environment. So how do we do that? We do that, I think somebody's got a raised hand, is that correct? Can we leave any questions till the end if that's okay?
Anything to hand raise a hand?
I'm not sorry. Stuffing's not. Okay. Sorry, I've just lost track of thought. But anyway, so employers have a requirement, obviously, to have a safe environment for their employees. And the legislation basically says we do that through a number of ways, in particular consultation with our staff and ensuring that we follow the risk management guidelines or a methodology. So consultation is paramount, and when we are looking at WHS, it's about consulting with our employees and ensuring that we consult with them at all time. So even when they're in the home environment, which is now their new workplace, we need to be consulting with them and to be able to communicate with them effectively. Risk management obviously involves a 4-step process. The first thing that we're always doing is identifying hazards in the workplace. So our requirements will be that we ensure that we get our employees to identify any hazards in their home environment, because that's their new work environment, to be able to then identify the risks that are related to those particular hazards. And I'm going to have to get my glasses, I'm really sorry. And obviously, we need to be able to assess those risks. What I have found over time is that employees are able to identify hazards, but they're not able to assess those correctly. And it's not a difficult process. It's about looking at the likelihood and the consequence of a hazard and what impact it would have to the employee or to the environment. But people find that a very difficult process. So it's important for us as employers to be able to assist our employees in being able to assess those hazards and those risks that are in the workplace. Once they've been assessed, then we need to identify from our hierarchy of controls, how do we actually control those particular risks? Is it by eliminating the risk altogether? Is it about mitigating the risk? Is it about adjusting the work environment to be more suitable to working from home, etc.? So that's our third step. And obviously, once we have implemented some strategies in regards to controlling those risks from home, it's about reviewing and maintaining that control. And this is where I get back to, I suppose, the title of the whole session: don't set and forget. Make sure that you're continuously assessing any new risks that may arise. I'm not able to move this on, I'm sorry. Okay, so the literature actually states that working from home, there's obviously quite a few hazards. As we said, poor ergonomics, poor workstations, employees spending more and more time on video conferencing and other ways of actually communicating. So the risks associated with working from home include musculoskeletal injuries, always hard to say, and they're injuries that are related to your muscles, your tendons, your ligaments, etc. Quite a lot of fatigue and burnout. Employees have actually made claims for fatigue and burnout and stress. Why are we more fatigued when we're working from home? Because it's very difficult to delineate between our work environment and our home environment. I know when I was working from home previously, I'd get up at 6 o'clock in the morning and log on, and I would be on the computer most of the day. I didn't have to walk far to get something to drink. I didn't have to walk far to get something to eat. And I was always concerned that, somebody might say, oh, why isn't Irene on the computer at this particular time? So fatigue, burnout, they can all be attributed to working from home. Not that it doesn't happen in the workplace, in our normal office environment or our normal manufacturing or warehouse environment, but it can be attributed because we're spending a lot more time working on the computer. There's a fantastic article by a lady called Kate Nielsen in the HRM, which is part of the RE publications called Unpacking Video Calls and the fatigue that's related to that. And she talks about what we call the plausible deniability of each other's absence, because our brains are actually trying to work out why we aren't socializing with other people. And she calls this cognitive dissonance, and cognitive dissonance can actually create fatigue, and she relates that back to video calling. Slips, trips and falls, because at home we probably have a number of different cords running around the place, or we might have staircases that we have to go up and down and we don't take care. We might have our pets at home. I've got a cat at home, and I know that I've tripped over him a couple of times. So they're sort of the risks that we've got to take into consideration. And also psychosocial risks. When we're not in the workplace, we have mental stress and fatigue, and that can impact on our psychosocial aspects, our physical aspect and our psychological aspect of work. So what can we do? What can employers do to ensure that we not totally eliminate, it's not going to be possible to totally eliminate, but to actually try and mitigate some of those risks that are associated with working from home. Not any different to what we would be doing in our normal workplaces, but as I said again, it's a different environment. Organisations need to have a look at their policies and ensure that we've got, working from home policies, that those working from home policies include checklists for our employees to access. Comcare, Safe Work New South Wales have got quite a lot of information at the moment about and have provision of checklists for employers and employees to use from working from home. Making sure that we include risk assessments for our employees to be able to assess the risks associated in their home environment. Making sure that our incident reporting policies and procedures are updated to make sure that if an employee does have an accident in the workplace, they know exactly how to report it. It's very, very important that all of our policies are updated and are actually developed to support what's happening in the workplace environment. As we said, consultation is another key aspect of the WHS requirements through regulation, through code of practice in consultation. It's important that we consult with our staff on a regular basis. So not just communicating, but consulting with them in regards to their work environment, making sure that we allow ourselves and make ourselves present to have those discussions with them. Incident reporting, again, as I said previously, is very important that we get our employees to report any incidents if they have an accident or a near miss at home, because it gives us an opportunity to then assess the risks and make any appropriate changes as required. We need to support our staff in setting up a safe workstation at home. There's lots of publications out there in regards to how you can set up a safe workstation at home, and having a checklist for employees to use to ensure that their workstation is set up appropriately is quite important. Encouraging good ergonomic practices. I know that on many occasions I haven't sat at the workstation, but I've sat in front of the TV or on the bed to actually do work. So we need to encourage and to remind our staff that they should be looking at the ergonomic practices, making sure that their chairs are aligned, making sure that their workstation is appropriately aligned, etc. Another interesting aspect is about setting clear boundaries. I talked about the delineation between home life and work life. It might be important for you to be able to say to your staff, make sure that you've got a start and a finish time during the day, that you take some time to have your lunch, to have a walk, to get away from being in front of your computer. Creating communication strategies. How do we communicate effectively with our staff? There are a number of different ways. Making sure that we check in with them on a daily basis, on a weekly basis to discuss any issues that they have, the kind of digital collaboration tools that they're to use in order to be able to communicate more effectively. We've got so much video conferencing happening, Zooms and Teams, and it's important that we have a structure on how we communicate with our staff. And if you know that one of your employees already has an issue, it could be a stress issue, it could be a psychological issue, it could be a social issue that they might have because they're working from home, or they might have a physical injury, etc. It's important that you as an employer utilise any early intervention programs to be able to support your staff. But the most important thing is obviously ensuring that you communicate with them on a regular basis. Employees also have obligations, obviously following procedures about how the work is performed. So when the employer is communicating and providing the resources, that they read those resources and they make sure that they do undertake a risk assessment and they do follow those procedures to maintain a safe work environment. Important that you manage your own house safety as an employee, because most of us are employees as well as the employer. Making sure that your electrical wires are in the right place, etc. The notification to the employee of potential risks, that's obviously important, and incident notification. If you are making changes to your home or your work areas, that you conduct a risk assessment and you let your employer know. And obviously notifying your employees if any incidents do occur. Oops, I've gone the wrong way, sorry. So 5 ways managers are talking with their teams, really important for the psycho analytical and psycho social component of ensuring that our employees' well-being is maintained, checking in, listening and acknowledging individuals' feelings, that's very important, asking open questions to make sure people are feeling well, sharing ideas about what works for people while they're working at home, showing understanding to your employees if they do raise issues and they do have issues in the workplace, and providing support, not advice. EAPs, employee assistance programs, can be recommended, or other types of support if required. Sorry, I keep on going backwards. I'm not sure if everybody knows, but on Safe Work New South Wales, there was an announcement made that as of the 14th of December 2020, the Public Health Order requiring employers to allow employees to work from home, where it is reasonably practical to do so, will be repealed. So it means that employers can now ask their employees to return to work as long as it is reasonably practicable. It's important that employers complete a return to, or what they're calling a safe return to work plan for their employees, and to register. Safe Work New South Wales has got a template available for you if you're interested in completing one of those plans. But basically, the requirements are that if you are creating this plan, you need to undertake a risk assessment of all your essential work activities. And if certain activities that do not meet the COVID requirements about the distancing, etc., if you've got some activities that aren't meeting those COVID requirements, and you are unable to make any adjustments in the workplace, those activities need to be ceased. You need to implement further controls on social distancing, barriers to create spaces at counters, in seated areas within your workplace, and workstations. You need to look at modifying shifts and rosters, so maybe looking at some people starting earlier in the day, finishing later, some people being able to work from home on certain days, just to ensure that you've got those social distancing measures in place. Signage and communication on practicing good hygiene, learning to spot symptoms of COVID-19 and making sure that people are not coming into work if they do have any of those particular symptoms. And as I said previously, actively supporting any flexible workplace arrangements. The correct use of PPE, that's another important aspect of ensuring when people go back into the workplace, they're doing that. There's quite a few, as I said, publications available, and even short training sessions on the Comcare site. Obviously, it's very important that we communicate effectively and that we supervise our staff and make sure that they're doing what they've been asked to do. We also need to look at reducing the environmental exposure, inspecting and reviewing our air conditioning, increasing the cleaning within the workplace, providing cleaning products and instruction for our staff, and obviously providing instruction and amenities for personal hygiene and infection control, and making sure that you know, those sanitizing sprays, etc., there's always sufficient around for our staff to use. I'm getting close to finish time. I've probably gone over the time, but mental health is obviously very important during this time. And it's really important for us as employers and employees to support each other. You know, we need to make sure that our staff are coping in this particular environment, and we need to keep checking in and keeping connected with our staff. Listening to how our staff are reacting when we ask them those particular questions, and reaching out and offering support if they're having issues. You know, being a trustworthy friend or a colleague, or referring them to EAP programs if they require. And if they're not coping, looking at strategies to provide them additional support through professional GPs or counsellors, or again, referring them to EAPs. And I think what I need to finish off on is that we need to instill a safety of culture within our organisations, and stage 3 is probably the most important stage of this safety culture, and that's where everybody sees WHS as being something that is natural and that we actually do, not that, you know, I have to do it or I want to do it. It's a natural habit that we follow every day, and WHS becomes something that, you know, is instinct to us. So in summary, don't set and forget. Always consult your staff, make sure that you're accessible and you communicate effectively. Assess risk continuously, because risks are always changing in the workplace. And be flexible with how you work with your staff, and trust them. So thank you for your time. I've probably gone a little bit over time, and your attention. So if you have any questions or comments, I'm quite happy to take those on board. Francesca said, great webinar, Irene, thanks. I was very nervous. I'm not really sure if I've covered everything that I really wanted to cover in detail, but high level, if anybody wants to have a conversation later on, I'm quite happy to have a chat. If anybody else has any other questions, happy to take those. Okay, so it doesn't seem like there's any more questions. So not from what I have one question, Francesca says. My staff seem to be working longer hours at office, working late. I've asked them to stop working those hours and they feel a need to complete. From home, okay. So yeah, they're going home and doing more work. Yeah, I think it's really important, Francesca, that we try and set some rules about that. I mean, I've been guilty of going home and completing work because there's not enough time. We really need to think about, you know, are we as employers asking too much of our employees? Are there not enough hours in the day? As I said, it's about communicating and setting those timelines and barriers and aspects of those, of when you should be working and when you shouldn't. And if there isn't enough time in the workplace, maybe it's about sitting down and discussing exactly what you've given that particular employee to do, or your employers. Maybe it is just too much. Catherine, hi Catherine, it's been a long time. Catherine says, aren't we working remotely versus working from home? Can we work from anywhere? Of course we can work from anywhere. I mean, I was talking about working from home today, but employees are always working remotely. As consultants, I know Catherine's a consultant as well, we're always working remotely. We're always working away from home as well in other organisations. And obviously, we've got to make sure that those organisations have the correct policies and procedures and that they've undertaken risk assessments. And we're sending our employees to work on other sites. So, you know, having safe work method statements in place for our employees when they're working remotely. I'm not sure if I've answered your question, Catherine, but yes, as I said at the beginning of the session, our workplace is anywhere where we're undertaking work, and that's the definition in the legislation. I can't see any other questions. I don't think, did I miss any? No. Oh, can employees refuse to come back to the office due to COVID? That's a very good question. Both the national and the federal administrators obviously say that we need to look at what is called reasonably practical to return to work. An employee must have valid, reasonable reasons why they can't come back to work. So, for example, I might be an employee who has a aged, ill person at home that I'm looking after. I'm their carer, and I'm concerned about returning back to work and maybe contracting COVID myself. That might be a valid reason. And a reasonable reason why I might want to work from home rather than returning to the workplace, even though my employer might have all the appropriate COVID measures in place. So that might be a valid reason. Again, it's important to consider each person's personal circumstances. They personally might be ill. I've got a friend who is susceptible to falling ill due to viruses, etc. She's been working from home for a very long time, and she won't be returning to work because of COVID. She also teaches her two children from home because she's concerned about her kids going to school and contracting any other types of virus or COVID. So it's about dealing with each employee and ensuring that they've got reasonable and practical reasons of why they need to work from home. So if they've got reasonable concerns, then obviously you need to consider those. You know what? I don't really want to go back. I didn't really want to go back to work full time either. And I think my excuse would have been, oh, you know, I really like working from home one or 2 days a week. You know, the Fair Work legislation says that we should be looking at flexible arrangements for our employees. So one of those strategies going forward is about encouraging staff to work from home if they can, 1 or 2 days a week, if that suits the organisation and they can work from home. Catherine says, good session. Thank you, Catherine. We need to catch up soon. I've scrolled down to the bottom. I don't think there's any more questions. So I'd like to say a big thank you to everybody that's attended. As I said previously, please go to our site and you'll be able to access the recorded session. If you're interested in a copy of the PowerPoint, I think that's also will be available. You'll need to contact us and we'll get you a copy of that. And we'll keep in touch. We'll let you know how things are going and what other sort of resources and advice we can provide you going forward. So thank you so much to everybody. It's been great. Don't know if I'll do another webinar, but I'll see how it goes. Thank you.